Welcome to today's show, folks, and thank you very much for joining me. I'm your host, Dave Norris, and this is the Memory Health Made Easy podcast. In today's conversation, it's all about reversible memory loss and can we do it? If you haven't done so already and you have enjoyed the content so far, I'd encourage you to subscribe. This means that you'll be the first to know when the new episode is released. Not only that, I'd encourage you to take a screenshot of where you're listening, post it onto social media, and maybe make a comment or two about what you've learned from today's show or in previous conversations. The reason I ask you to do that is obviously tongue-in-cheek. It's great for us to help you and others to reach more and serve more folk to stop avoidable memory loss. But not only that, by sharing it, liking it, discussing it, you're also putting yourself in a better position to recall it and apply it. And that's what it's all about, guys, is taking steps, taking action with this content and having, I guess, a life-changing experience where you can position yourself to be in a much better position in reducing your risk for avoidable memory loss. In today's conversation, it's all about reversible memory loss and can we do it? One of the things that are at the heart of all of our conversations is around lifestyle changes. And if you want a real cheat sheet, a guide, a short track method to keep you on the straight and narrow, then we've created the 9 principles for memory health for life, which is a summary of all the things that you get to listen to on this show, distilling it down into those 9 core pillars that we believe are fundamental for memory health for life. Go to memoryhealthmadeeasy.com/learn and you'll see the opportunity to grab that free resource. So let's get into today's show. G'day, this is David Norris and this is the Memory Health Made Easy podcast, brought to you by memoryhealthmadeeasy.com. Easy to remember, isn't it? G'day and welcome to the Memory Health Made Easy podcast. I am your host, David Norris, and I'm here to reach more, serve more, and to create more memory health in people. Thank you for joining me. Today we're going to discuss, is my memory loss reversible? And we're going to look at 9 causes of temporary memory loss, where people may experience changes in their cognitive fitness and have a mild cognitive impairment, which is temporary in nature. Now, for many folk, they might be going, wiping their brow and thinking, oh, that's great news, Dave. I always thought it was a one-way street. Well, the good news is we can have an impact and reverse many of these scenarios. But, and there is a but here, that if we are to have these experiences of temporary memory loss and experience what we are sometimes observing as mild cognitive impairment, we are 6 times more likely to progress to dementia. But I want us to be aware that it is not one-way traffic. And I think that is many of the fears that when I speak to people, that they're of the opinion that it is always one-way traffic. Now, to borrow the words of Professor Brody, in 2018, he came out and said that the biggest barrier to healthy and happy aging is brain disease and memory decline. And that really goes to the fear of many folk, which is, as we get older, I'm worried about losing my independence and losing my memory. So, regardless of whether it's temporary or not, those odds certainly stack up in the favour of decline should we end up there. And I want us to pay attention to the temporary changes and therefore what can we do to reduce our risk for these scenarios? Because, in my opinion, memory loss is a life-threatening issue. It erodes our confidence and certainly it steals our independence. So, temporary memory loss certainly happens. It happens. And like many of us, at some point, you've likely run around the house searching furiously, upending drawers, looking everywhere for those glasses. I know I certainly do. And maybe a few days later or later that day, you'll have I remember it. Or perhaps you've bumped into a good friend and for all the tea in China, you can't remember their names. You can't help but maybe scratch your head and think, maybe, is this normal? You know, I just want to know whether this is normal or whether this is a signs of something more sinister that I need to pay attention to. Well, for most of us, the experience of memory change is very temporary and in many cases easy to reverse without too much effort. But whether it's the occasional forgetfulness or there is a loss of short-term memory, there are a number of factors which can cause this short-term recoverable experience. And it's worth bearing in mind some of these things are normal and some of them are not. Your memory, much like a sailboat, can have smooth sailing days or it can be buffeted by adverse conditions. The same goes with temporary memory loss. When the conditions change, your performance can go back to operation as usual. However, the more we're exposed to these conditions, these poor conditions, the likelihood of damage is going to increase, and it sets us up potentially on more of a trajectory downwards into a disease state. We don't want to end up there, and that's what today's podcast is all about. So our ability to learn and our performance in learning skills over time as we get older is a little bit more difficult. Our acquisition of skills takes more time. When you combine sensory changes such as our hearing and our vision as we get older, then the ability to recall new information, new learnings on a short-term basis can be challenged. However, other areas of our memory performance, such as our historical information, is strengthened, is more robust. So what's encouraging despite these changes over time is that your ability to know more increases provided you keep at it. And the best way to keep your memory sharp is really a brain healthy lifestyle. In our memory health and fitness clinic that I run, we apply brain training strategies targeted to improve memory, attention, concentration, and processing speed. And we combine that with those lifestyle strategies that I guess you're becoming pretty familiar with by listening to this podcast. And these are the known culprits which can disrupt our memory health. So whether it's the occasional forgetfulness or there is a loss of short-term memory, there are a number of factors which can cause this short-term recoverable experience. So here are 8 obvious and potentially not so obvious signs that your memory health has changed. Forgetting people's names or faces. Forgetting conversations and conversation details. Perhaps it's around irritability. That emotional change can sometimes be a reflection of changes in our memory performance. Getting stuck or lost in the middle of a task is another. Number 5, ending up in a room where you've asked yourself, what am I doing here? Number 6, maybe there's the fogginess or overall mental lethargy, which impacts your attention and ability to recall events clearly. Number 7, reading a passage of print and not being able to recall the details and the content later. And number 8, getting stuck with phone number dictation, like for example, 1300, what's the rest of it? Or that mobile number that's on the tip of your tongue normally, but you get stuck. PIN codes are another classic example. So these are signs that, memory health change or your memory, that's a sign of temporary memory loss, that they're popping up. Now, the question is, and more importantly, how often do these temporary memory loss symptoms occur? The key question here is, how frequent does it occur? Is it infrequently, that they happen rarely, but they do occur? Occasionally episodic, sometimes, but consistently enough over a month or a weekly period. Persistent, mild to moderate, they're persistently occurring with mild to moderate symptoms and impact on my day-to-day performance. And they're persistent and severe. Symptoms occur most of the time with significant impact on my day. So when we start to get a handle of our symptoms, what are then the root causes or the contributing factors to this? So now you're a little bit clearer on what are some of the symptoms and also the frequency and consistency of those symptoms. The question is, due to what? And thinking about those temporary causes, let's get into those 9 factors commonly associated with temporary memory loss. Number 1, medications. There are many classes of prescription medications and over-the-counter medications which can affect your memory. Medications which affect your acetylcholine levels will likely have an impact on your memory performance. Those which lower the acetylcholine levels are observed to increase forgetfulness, reduce your concentration, and you'll likely experience symptoms like foggy brain, blurred visions, and can mimic symptoms like dementia and delirium. Other drugs to be mindful of include sleep medications, cholesterol-lowering drugs, antihypertensive beta blockers, anti-anxiety medications like benzodiazepines, pain management medications, and antipsychotic medications. Now, just a word of caution about taking immediate action with regards to your medications. I would encourage you, in fact, I'd say strongly recommend that you have a conversation with your local doctor, with your general practitioner first, before thinking about doing anything with regards to your medications. Your GP is your team player. He or she is going to have an understanding about what are the influences those medications are going to have and what are the impact. Have an open conversation with your GP about what they could suggest or offer as alternatives that could still achieve your health outcomes, but also reduce your risk for temporary memory loss or experiencing ongoing memory health changes. So I just want to underscore that. Have a chat with your GP first before about making any decisions with regards to your medications. Number 2 on the list are nutrition, or lack or deficiency of a nutrient-dense diet. So simply, what you eat directly affects the structure and function of your brain, and ultimately your memory health performance. 95% of serotonin is derived from your gastrointestinal system. So our brain requires a significant amount of energy as well. With 20% of calories available in your diet will go towards your brain's performance. So the right fuel will help your brain do the job it needs. Fats, proteins, and carbohydrates are all needed in the brain for it to perform at its optimum. An absence of certain fats, proteins, and amino acids can have a profound impact on your memory health's performance. Vitamins like vitamin B12 helps maintain healthy nerve cells and red blood cells. A vitamin B12 deficiency, which is quite common in older adults, may contribute to memory health problems. A study conducted by Professor Phyllis Jacker and her team in 2015 showed the relationship of poor diet and depression. And furthermore, a recent paper explored the role of diet and neuroplasticity. So there is a strong association and correlation of what we eat determines our brain's performance and also our mental health for experiences like depression. So previously we've discussed in other episodes about diets like the Mind diet and the Mediterranean diet for reducing your risk for Alzheimer's type dementia, and it's maybe worth looking back at those episodes again. I believe these episodes would add valuable content to this conversation today about reversible memory loss. Dr. Sherney and my conversations in episode 12, we did discuss that the role of lifestyle interventions not only is preventative, but also has a powerful role in reversal and curative elements of chronic disease, that it would be worth revisiting in episode 12. I'll put those episode links in the show notes over at memoryhealthmadeeasy.com. Wow, a lot of stuff in this episode. Be right back into it. I want to share with you a little bit about memoryhealthmadeeasy.com and what you can find over there. Programs, resources, and community, all with one goal: to help stop avoidable memory loss. Here's a great place to start. The Memory Health Checkup shows you how to identify your personal risks and also set a map and course about what to do about them. The Memory Health Fast Masterclass gets you out of the gates quickly around applying the 9 principles for memory health for life. Want to work out your brain? Improve your brain performance with How to Train Your Brain. It's a 30-day brain optimizing program. And of course, we've got our flagship community, which is all about support, and you can ask me any question, where I'm your memory health coach to guide, support, and cheer you through the steps to achieve memory health. Come on over to memoryhealthmadeeasy.com/products where you can find out more. Now let's get back to today's episode. Number 3, alcohol and smoking. Long-term alcohol use has been associated with memory loss. Blurred vision, reduced balance, slurred speech, slowed reaction times, and impaired memory are clear evidence of how alcohol affects the brain. A number of factors influence the effect of alcohol, such as how much and how often a person drinks, the age at which he or she first began drinking, and how long he or she has been drinking. The person's age, level of education, gender, and genetic background and family history of alcoholism. Your exposure before you were born to alcohol is also another factor, so what we would call prenatal exposure. And of course, it goes without saying that your overall health and well-being is going to be a contributory additive factor. Remember, sometimes our risks for memory health issues and chronic disease isn't just a 1 + 1. One risk plus one risk equals 2. In many cases, it's 1 + 1 may equal 5 in terms of increasing your risk. As weird as that sounds, it is an over-amplifying effect of when we have many factors combining together. That's why it's super important that we try and get ahead of these as much as possible. Smoking reduces the blood supply to your brain and affects the health of your arteries, the blood delivery system to your brain. Heavy smoking is associated with cognitive impairment and cognitive decline and is especially observed in middle-aged people. Lack of sleep. This is something that I've mentioned in earlier episodes. Sleep quality and quantity have been associated with memory performance changes. Lack of sleep or poor sleep can affect fatigue, which directly impacts your performance, especially in working memory. Number 5, depression. Well, I've referenced this earlier with the work of Professor Felix Jacker. Experiencing depression can affect your ability to pay attention, focus, and to experience pleasure with the tasks at hand. Depression is associated with short-term memory loss. We recall better when a task is emotionally underlined or emphasized. Depression, no doubt, can reduce your positive experience of the world. Number 6 is stress and anxiety. Too much on your to-do list? Are you distracted or busy? Well, sometimes that's me, that's for sure. Stress and anxiety can also be a snag in your concentration performance. Being in an elevated or tense hypervigilant state can contribute to a sense of being distracted, and your ability to remember can suffer. Stress hormones, the stress hormone cortisol, is released in large amounts during times of anxiety. Cortisol affects the brain and is associated with memory loss. These memory problems aren't considered to be permanent or represent any type of loss of brain function, but they can certainly trip up our performance in that sort of immediate context. Stress, also caused by an emotional trauma, can also lead to memory loss. Number 7, infection. Whether it's the common cold or things like a urinary tract infection, an infection can impact on your memory performance. Number 8, hormone changes. Well, I've alluded to the stress hormone earlier, cortisol, but also another hormone that's worth mentioning is an underactive thyroid gland. May contribute to a reduction in mood, energy, and mental arousal, which can add up to less ability to recall information. An underactive thyroid gland or hypothyroidism can result in forgetfulness and other thinking problems. Number 9, trauma. Mini strokes like transient ischemic attacks and mild brain trauma or concussion can temporarily impact your memory health. As a clinician working in a large hospital many years ago, I would often see the impact of violence and see the temporary changes in people's ability to recall things. We would give them a simple task of remembering a name and a face and a couple of objects, and they would have to remember them on an hourly basis or a daily basis. We could see that there was a post-traumatic amnesia, meaning that they had the difficulty in acquiring and retaining information over a short period of time after the injury. This appeared to resolve over time, but there were other host of associated symptoms that would follow folk after an injury to the brain, such as depression and anxiety. A transient ischemic attack or a mini stroke can be very temporary, and in case of trauma, memory health changes may be felt over a short to medium term. I'd like to include in this bucket also things like surgery, like heart surgery. Many clients that I've seen in the past after heart surgery will describe that their memory is not as sharp as what it was prior to the event. Similarly, people that undergo chemotherapy will often describe a sense of brain fog and lack of clarity impacting on their cognitive performance. If I was to pull out a pen and paper test or use some of my targeted assessment tools, we would see that those changes would be dramatic enough to affect their score against their peers, and so we would describe that as a mild cognitive impairment. Again, these things are temporary. So what is the treatment for temporary memory loss? Well, treatment for temporary memory loss will often depend on the factors, those root cause factors which contribute to it. If it's a hormonal component, guess what? We've got to treat that. If it's more around a lack of nutrition or deficiency in our nutrition, then we've got to treat that. If it's around alcohol and smoking, absence or reducing our exposures over time is certainly going to have an effect. What I would encourage you is that use the list today, those 9 factors. Use this list and audit where you're at against those things. Are there areas that are problematic for you or maybe contributing to your experience of subjective cognitive impairment? Now, remembering that that's about my own assessment of myself. That is, I don't feel as sharp as what I used to be, or I'm not on, or I'm a little bit foggy, or I'm lacking that clarity. I would argue that this is an alarm bell. Is this the canary in the coal mine for you to be aware of? And it might just give you pause to consider where you're at with the things that you're doing. The problem that I see so far is that people are not treating these memory health changes as life-threatening issues. If I was to go full circle and roundabout back to the beginning of this podcast, remember the snowball analogy. If we're going to move the snowball and stop it rolling down the hill, we're better off doing it at the mountaintop rather than halfway down the mountain where we are experiencing these temporary changes, and our risk for more marked and significant memory loss is increased by 6-fold. If our memory performance declines, it can have a real consequence to our independence, quality of life, and ability to work and have overall health and well-being. I want us to be treating health and treating wellness rather than treating sickness. Temporary memory loss does have an upside. I guess it can spur you into action. It's clear that the best approach to protecting and maintaining memory health performance is to live a life aligned to a brain-healthy lifestyle. My name is David Norris, and this is the Memory Health Made Easy podcast. I want to thank you very much for joining me today. If you haven't subscribed today, please do so. Please, I'd also ask of you if you could leave a genuine review. It helps me achieve our mission, which is to reach more, serve more, and to create more memory health in people and to stop avoidable memory loss. Folks, we can do it. We can reduce this risk, our risk for memory loss, and have a significant impact on our lives. And I want as many people to hear this message as possible. Your help is greatly appreciated. So that's it from me. Many thanks for your attention, and as always, I am super grateful and appreciative of your precious attention and time. If you have any questions for me at all, feel free to reach out at Twitter. That's probably a great way to reach me, at MemoryHealthMe. That's right, you can follow me at MemoryHealthMe, David Norris. Thanks again, folk, and until the next episode, talk to you soon. Bye for now. So there you have it, guys. We've covered off, is my memory loss reversible? We've touched on the 8 common signs of temporary memory loss. We've also spoken about the 9 causes of memory loss. So we spoke about the signs and causes and what you can do about it. Some real tangible actions. Please take action with this. The best thing you can do and the best way you can help me is start taking action in your life, whether that is talking to your GP, coming up with a personalized plan, or reaching out and diving into more of our resources. We have got some great resources over at memoryhealthmadeeasy.com. If you really enjoyed today's conversation and have enjoyed other conversations on the podcast, Memory Health Made Easy, come on over. And I'm super excited to announce, ready, drum roll. That's right, I've got a Facebook group, Memory Health Warriors. A Memory Health Warrior is somebody who wants to turn up for themselves, their family, and their community, to have abundant energy and to play life fiercely so that we can have a beautiful brain for life, for memory health for life. The tribe's mission is simple. We're going to achieve 1 million beautiful brains, healthy, gorgeous brains, so that we can have memory health for life. And it's for folk who want to go a bit deeper with the content around the stuff that we go through here on this podcast. So join me over on Facebook at Memory Health Warriors. That's right, plural. And come and see what it's all about. Until next time, I'm your host, Dave Norris, and this is the Memory Health Made Easy podcast. Thanks for listening. The purpose of Memory Health Made Easy podcast is to educate and to inform. It is no substitute for professional care by a doctor or qualified professional. This podcast is provided on the understanding that it does not constitute medical or personal professional advice or services. Instead, we would encourage you to discuss your options with a healthcare provider who specializes in your particular needs.